Morning everybody. Can I start by thanking the State's Chief Medical Officer, Chant, but also the Secretary of Health, who's also here, on their efforts in the past few weeks and now months. We appreciate deeply what they've done on behalf of the citizens of our state in relation to attempting to contain this virus, but also reducing the spread, but also ensuring there's good public information out there for our citizens. I also want to acknowledge the efforts of the Minister for Health, and of course today relevantly the Minister for Education is also here. I can confirm that since last night there have been 2 additional cases in New South Wales. We are now at 26. The 25th is a student, as you know, at Epping Boys High School. The 26th is an additional staff member at the nursing home that's already had 2 diagnosed cases. So that the total number of cases in New South Wales is at 26. I also want to stress that the decision to close down Epping Boys High School today was a precautionary one. It is one we took to allay the concerns of parents or other students who might have had close contact with the student, but to say that it's given all of us a breather, the experts a breather, to assess the situation over the weekend and make a decision on Monday. It is a very precautionary approach. We appreciate that this is the first example, we believe, in Australia where a student in a school environment has been impacted, and we took the precautionary step. We didn't take the decision lightly to ensure the school stays closed today, and we provide adequate information to parents and to teachers, and of course the students themselves over the weekend, and give them good advice on what's happening on the day. I want to stress to everybody that the New South Wales Health website has up-to-date information on the virus, on what people should do as precautions, and I say again as a State Premier that I have full confidence that our health system is doing everything we can to reduce the spread of this virus. And we ask everybody to stay calm and to take the precautionary steps that have been recommended, and to ensure not just that you think about your own safety, but to make sure you might be a carrier who has a very mild case and unintentionally pass it on to others who might be vulnerable. And that's the clear message today, to think about others in the community, but also to take all the precautionary steps you can in relation to containing the spread of this virus. We appreciate that for many people in the community it is a very concerning time, but we also say, please put things into perspective. If you're doing all the right things, make sure you self-isolate if you feel you've got any symptoms, stay at home if you're unwell, follow the basic procedures, and at all times know that our health system is on high alert, that we have various plans in place for the various scenarios that can emerge in the next weeks and months. If you look at the flu season, it goes on for a number of months. We're anticipating this virus will have a life or a concerning phase of a number of months ahead of us, and it's important for all of us to go about our business, but also to be on high alert and aware of the steps we have to take personally to prevent the spread and also to take care of our own safety. Again, thank you to all of our health professionals who've done an amazing job to date, and I also want to thank all the government agencies that are involved to make sure we've got a whole-of-government approach. We want people to feel confident when they're catching public transport. We want people to go about their daily business, but to take the steps that are already out there in the public domain, and to also make sure that if you do have symptoms but you're feeling fine, a number of people, including myself, tend to soldier on if you're not well. But in these circumstances, we say to everybody, it's not time to soldier on. Make sure you take a precautionary step, stay at home, and don't unintentionally pass it on to vulnerable people who might end up in hospital as a result of picking up the virus. So thank you again, and please follow the health instructions.
I've got a number of other updates that I'd like to give you. So just in relation, as the Premier indicated, we've had another worker at the facility confirmed today, and that takes the total to 4 residents and 2 healthcare workers. We are undertaking daily reviews of the residents of the facility, and we are undertaking swabs as a very precautionary approach there. And I did in yesterday's press conference indicate that we could well see additional cases in that nursing home, and that wouldn't surprise me. What we're actually trying to do is prevent any further onward transmission. And I'd like to acknowledge our partnership with Baptist Care and the role of the nurses and the staff of the facility. I can also say in relation to the childcare, Banksia, there were, as you're aware, I indicated yesterday that there was going to be a clinic held to assess the children that had attended the nursing home, because there were some respiratory symptoms in that group. And I'm pleased to say that that clinic was conducted last night at the Sydney Children's Hospital Westmead, testing undertaken, and those results came back all clear for COVID-19. As a precaution, the child group that visited the nursing home will not be allowed to attend the childcare centre until next week, which is the 14 days since the visit. If any of them are unwell or change their situation, we will again reassess them for the utmost of caution. In addition, we have, I gave an update yesterday that we've located 76 of the 77 that attended the radiology workshop at Liverpool Hospital, and all have been cleared, or if they have had symptoms, they've been, COVID-19 has been excluded. We're still waiting one contact with one individual. We've tried multiple different channels to contact that individual, and we'll continue our efforts. In terms of one of our cases that we reported that was diagnosed late on the 4th of March, on re-interviewing and interviewing that person, we indicated that she actually worked whilst infectious at Canterbury Hospital on the 25th of February and the 3rd of March. And that has led us to the identification of 28 staff, 13 close contacts and 15 casual contacts, and they've all been given the appropriate advice around isolation. We are also, some of those contacts did have symptoms, and as I said, as the utmost of precaution, those individuals are being tested. And there were 3 patients who were in close contact with that healthcare worker. I think that summarises the outcome, and we're happy to take any.
The situation involving Epi, there is a connection there with Wright Hospital. I believe the parent of the student worked at Wright Hospital. Can you clarify that situation?
Yes, so the healthcare worker whose son became unwell and was tested for COVID-19 did work at Wright Hospital and was identified as a contact of the 53-year-old gentleman that is now in Westmead Hospital. And that I can confirm that healthcare worker is well, but the child did have symptoms and the child was tested for COVID-19, and that's come back as a positive result. We're obviously investigating the household, and we've also ascertained all of the as its usual process. We interview and identify any close contacts, household contacts. Those individuals were spoken to and put into home isolation. We look for any symptoms in the close contacts, and then we exclude COVID-19 in those individuals.
Are you satisfied that everything's okay at Wright Hospital? You don't think there's any need to close the hospital?
Wright Hospital has taken extensive actions, and I can confirm, I think as I indicated yesterday, that we're in daily contact, and there's daily contact with all of the staff that have been put into home isolation. And if there is any diagnosis of COVID-19 in any of those individuals, I'll let people know. And because those individuals have been removed from the healthcare setting for over 24 hours, no one is placed at risk, additional people are placed at risk, and that's the whole purpose of our very precautionary quarantining of the close contacts.
So can you explain the science behind that? How is it that the likelihood is that COVID has jumped from the right doctor to the mother who is a colleague? She's showing no symptoms at all, but somehow has passed it on to her son.
So I think that we should not get ahead of ourselves in understanding this situation, and I think it's very important that we are very careful before jumping to any conclusions. We're currently investigating. Clearly, I've said to you that those cases where there is no overseas travel are the ones that cause me most concern. Where they're linked to overseas travel, it's very clear. In terms of those community transmissions, and we have 3 of those, with the doctor who attended with the other doctor at the radiology conference, then that's a clear epidemiological link, and we'll be further re-interviewing those cases to gather information about the nature of contact that they had. As I indicated, 76 of the 77 who attended that event have been cleared apart from that one doctor. In terms of the remaining staff at the hospital, you wanted me to explain the situation around the...
How does it jump from Wright Hospital through an intermediary who doesn't have it through to the... if that's the presumption.
So I think what I'm challenging you is I think it's too premature to conclude that presumption. What we're looking at is also whether there can be, we have to keep an open mind. We obviously have to investigate all scenarios, including that scenario, but also scenarios such as that the child's come into contact through a different mechanisms. It's always important going into these investigations that we take a very scientific approach to exclude all avenues.
You take a scientific approach.
You can't give a specific answer, I mean, beyond any scientific certainty. But it's an extraordinary coincidence.
Well, we are undertaking the investigation as we speak. I mean, this result came back late last night at 9 o'clock. We had to make the decision to close the school to allow us time to work through this issue. I'll update you, but we're in close contact with all of the family and any other close contacts that were identified last night. Advice was provided to a vast range of close contacts last night. Those individuals were isolated, and then the steps were taken to actually give recommendation for all students to be home isolated. And the reason for that is we really do want to understand who could have been in contact with this student, and we felt that we couldn't make those decisions on the run. They're too important, and I just want to acknowledge it may be an impost, but I hope the community understands that we're taking this very precautionary approach, and we want to work through this very carefully today.
We have a report that a maternity ward in the San Hospital in Wahroonga has been locked down as a precaution.
I don't, but I'm happy to follow it up. As you understand, these situations are rapidly evolving. We'll go and check that.
Will New South Wales Health be banning visitors to other wards as a similar measure to protect patients from potential coronavirus cases?
So what we're suggesting is some common sense approach to visiting hospitals. And so what we're actually saying is, can we make sure that before visiting anyone at the hospital, the first pivotal thing is if you have any symptoms of an illness, albeit incredibly mild, please defer visits. If we then ask that you wash your hands, and when you enter our facilities you'll see a variety of options for hand washing, please take use of those the sanitizers, hand sanitizers, and making sure that you wash your hands prior to visiting and entering the ward area. And please also wash your hands before departing. These are simple measures. We're also asking that visitor numbers be kept down and managed at 1 or 2 visitors per person, and that the visitors are staged. And this allows us to not have large numbers of people. It also allows the nursing staff and other staff to actually monitor visitors and prompt them if they haven't washed their hands. And so it's a practical measure that we want to take and get that message out.
Are you satisfied that the school can just be closed for one day? You don't think that you need to take a more drastic step? You've got 1,100 kids. We know this virus spreads very easily. Have you contemplated the fact that shutting that school down for 2 weeks?
We've certainly, when we go through these processes, contemplate all measures, and we will. I think the community needs to know that we're prepared to take whatever action is in the best interest of the students and staff and the broader community.
Is that a distinct possibility?
It's one of the range of possibilities, and we are going to be having a discussion with a range of experts at 12 o'clock and based on some additional information that we've gathered from our public health unit director visited the school this morning, and we've been doing further investigations today, looking at the absenteeism pattern, looking at whether there are any the sick bay records and other information, and we will consider all of the information and then make a decision. And I ask that the students and parents please monitor the Facebook posts and their emails, and we will provide that advice. But having this day off and the fact that it's a Friday before a weekend does give us time And I just ask the school community's forbearance as we work through this and gather all the facts so that our decision can be made on all of the best available information.
We were talking about the 24-hour period the other day. I mean, that extra weekend gives you 72 hours, which obviously is a crucial window to see if anybody else is falling sick. Is it the likelihood?
It's a slightly different concept because what we have is that people are, we are acting as if people are potentially infectious for about 24 hours before their symptom onset. And that takes into fact two considerations. One is that the symptoms might be quite mild, and so when we're getting case reports that people got sick at something, we want to have a buffer period. But also, in the event that there is a window before people becoming symptomatic, which is still a matter of debate, we're taking for the utmost caution. So that means that if I've been in contact with you, and if I'm actually well 24 hours after I've been in contact with you, then you have nothing to worry about, because that is the asymptomatic period where I'm not expressing symptoms, where I potentially was at risk of transmitting to you. And so that's why I have comfort that the fact that we haven't detected it in the doctors and healthcare workers gives a comfort to all the patients and other people, because we're not then looking at a broader group of contacts of those doctors who have been quarantined. And that's the whole premise of why we are taking a very precautionary step at the moment and quarantining healthcare workers and other close contacts. I also indicated to you that the policy around these will be moving as we move into different phases of the community spread, and that will be very important. And I also indicated that that shouldn't be called a matter for alarm. It should be actually seen positively that we're responding to the available information and making sure that we continue to reflect on our decisions. And for instance, we may actually shorten the incubation period, and that may be based on emerging international evidence. So that gives an example that messages will change.
Premier, the Prime Minister has just announced a short time ago $1 billion extra money going into this. How much are you expecting to get of that? And what will you use New South Wales' share of that money for? What's the priority?
If I can be perfectly frank, our absolute priority at this moment is getting information out to the people of this state on the health precautions they should take. And that's my message today, is to make sure everybody takes those precautions we've put in place. And to literally stay calm. And it's really important to note that many people who contract the virus won't need any hospital care. They'll actually be able to stay home even when they've got the virus. So we don't want people to feel that this is something to be scared of. We want people to come forward if they feel they've got the symptoms, but at the same time, we want people to put everything into perspective. And yes, we are going to see cases escalate. We're going to see challenges in terms of decisions we take around how to contain and reduce the spread.
If I can go to the question though, and that is that we're hearing stories about GPs going down to Bunnings to buy masks and complaining that they're not getting the PPE they need to get potentially patients.
Certainly, you can rest assured that the New South Wales government is doing everything we can to not only support in every way we can all of our health practitioners, but also ensure they have all the resources they need.
But that's not what they're saying. That's not what they're saying.
I want to make that very clear, that we, in situations like this, health and safety come first, and we will ensure that everything that our practitioners need in New South Wales is met. And I'll ask the Chief Medical Officer to comment on that point.
The GPs are telling me they don't have the resources on the ground to deal and safely manage patients. So what is the government going to be doing about that?
So a couple of aspects there. Just to assure you that we have already attempted to procure as many masks as we can for the public health system. We're also managing the supply of that to prevent any hoarding and managing locking down those supplies, because we are going to know that masks, I think you've all heard that from other avenues, masks are going to be in a tight supply environment. In terms of our GPs, we actually did provide some support for general practices, some P2 masks and surgical masks through the primary health networks, and that was followed very quickly from the Commonwealth. And we only acted quickly because we were hearing those messages, knowing that the Commonwealth is really the best place, given their stockpile, to provide support for general practice. I understand the Commonwealth is working through its policy in relation to masks, and that's a subject of mask policies on the consideration of the Australian Health Protection Principal Committee today. but we would envisage that there will be a strategy announced by the Commonwealth that deals with the issue of GP access. But I think we have to be clear that we have got supplies of personal protective equipment for our health staff in the health system, and at the moment we need to really be encouraging our health workers and others to familiarise themselves with the requirements, because we really want to keep our healthcare workers safe. They are at the front line and they are at the greatest risk, and we need to support them.
Minister, can I just ask you a question? Minister, can I just ask you a question, please? What is being done to help GPs on the ground at coalface managing patients that are going in with symptoms?
Well, first of all, can I emphasise what the Chief Health Officer has said, and that is that the New South Wales Government runs state hospitals. GPs are in the domain of the Federal Government. Having said that, the Federal Government and the State Government are working together. And the issue has been discussed in terms of the some GPs' concerns. The assurances that we've had from the Federal Government have been that, as late as about an hour ago, are that there are sufficient masks available, but perhaps some of the public health networks, which again is a federal body set up to support GPs, some of those PHNs may not have actually communicated as well as they should have with the GPs who are members or who perhaps are in their area. So, as I understand it, the federal government are taking steps to try and make sure that information is available. Having said that, of course, when there are gaps that might occur, whoever's responsibility it is, federal or state, we're all working together. So, as the Chief Health Officer said,
they're saying there are big gaps at the moment.
Well,
There's no.
I've answered that now.
Minister, what about people who've been told they need to go into self-isolation, even if it's just a precaution? They're missing out work sometimes for 2 weeks. What kind of support can you offer them, and what would you say to people who are worried they can't get paid for 2 weeks?
Well, obviously our government would certainly share concerns for people who may not be able to be paid. But this is an issue right across Australia, and it's something which the federal government has to sort through. And certainly we will be giving them support on that, and those items are being discussed. There's no clear answer at the present time.
Can I ask you just on one thing? There's a vulnerable group that we haven't really talked about, and that is elderly either living at home. You look at a classic migrant family. You might have a grandparent, parents, children, who may be vulnerable because of age, or other people who are immunocompromised, cancer patients and so on, who may have children who go to school, they could be coming back, bringing stuff in. Is there any suggestion that for people in those situations, to keep them safe in home, that there may be a supply of masks, further instructions that may come to them, whether there are more hand sanitizers which are in short supply, might be made available to people who are particularly vulnerable but still in the community?
Certainly there are hospital in the home arrangements where our staff are going out to work with people who are at home and making sure they are well cared for.
And who's filling in the gap for those medical staff that are quarantined, for example, or are being tested? Who's filling in the gap?
I'm going to let the Chief Health Officer answer that.
Yep.
So we've basically had to call upon staff in some cases when we've had to take out a range of staff at short notice. I'd like to say thank you to those staff that agreed to work back whilst we could organise, the local health districts could organise replacement staff. So we've obviously called upon staff that were not contacts to come into work, to do extra shifts, as well as bringing on locum and agencies to fill those gaps.
This is only the beginning, and it will likely get worse. So what contingency is there if that gap of staffing continues?
So as I indicated, as we work through this, at some point our policy settings will change, because once the community spread, if the community spread becomes quite high, then the requirement around or our knowledge becomes enhanced. The issue of the 14 days may well be reduced significantly, or we actually may move to messaging about being aware of symptoms and then self-isolating immediately. So we are using a range of strategies, including deploying staff from agencies that are working not on the front line to the front line. But I don't want to leave the impression that it's not other than challenging, but everyone is working as hard as they can to ensure that we have plans in place to surge to meet the anticipated needs should community transmission occur more widely in our community.
Are there any
Final questions, please.
No.
Would you be able to explain when that worker caught the virus?
So that worker had actually returned from Iran, and so that was the place of acquisition. And then, as I said, those investigations revealed that she had actually worked 2 shifts at Canterbury, and then that triggered the subsequent investigations, which have led to, as I indicated, 28 staff members being identified and 3 patients as close contacts, and that public health action has now occurred to provide them with advice.
But the
Premier, can I ask
she
you about funding
diagnosed?
arrangements? The Commonwealth Government has announced a 50-50 split of funding arrangements between the state and Commonwealth. Do you find that significant enough? They've got a larger kit than you do. Is a 50-50 acceptable?
Oh look, the federal and state governments are working together closely on this. My preoccupation is on public health and safety and to make sure people have the message about what they need to do. Us politicians can worry about how to pay for it, but this is really about making sure that people in the community have the information they need, that everybody goes about their business and stays calm. And whenever I speak on this issue, that's what I want people to hear. And similarly, can I commend again the state's Chief Medical Officer and the Health Minister for being so proactive in providing information to the community. And I want to say this, no expense will be spared to make sure we keep public safe at all times. But I also want to thank all those workplaces who have employees working from home who are on full pay, and thank them for proactively taking that step. And I envisage that, just as we've seen in recent months, that everybody is going to work together, everybody's going to step up to do their part in keeping people safe and also ensuring that people stay calm as much as possible.
In your briefing about funding though, I mean,
Yeah.
you didn't answer
Yeah.
an iota on funding.
Yeah.
Are you happy with a 50%?
Well, I think I have. I think what I've said to you, and I've said from day one, is we're absolutely committed to working with our federal counterparts. We welcome the support we're giving each other.
Is 50%
and the
enough
cooperation.
from the federal?
At the end of the day, this is about making sure it doesn't really matter who's paying what. What is important to the public, what is important to the community, is that all of us are focused on.
In your briefings,
safety,
Premier,
that we're all committed to the public safety. Yep.
in your briefings, you know, were you told this is what to expect? We had a nursing home, we've got 3 hospitals, we've
absolutely.
got a high school.
Yeah.
Is this the worst case scenario
Oh,
that
it's-
you've been warned about?
Look, can I say that we estimate, the escalation, there's no doubt that we are not anywhere near the worst of this. Let's make that very clear. So what we need to ensure is that everybody has the appropriate information to reduce the spread as much as possible. We haven't even hit the winter months. As you appreciate, to date, most of the cases have been in the Northern Hemisphere where it's winter. We've not yet hit our winter. So we're obviously, I'm grateful to the health authorities for giving us really great information on the potential scenarios. And what we need to do is learn from what's happened elsewhere, but make sure we reduce the spread as much as possible. And that's why from day one, the New South Wales Government, guided by the experts from health, has taken overly precautionary steps to ensure that we reduce the spread as much as possible.
Final question, please.
Mr. Hazzard, you mentioned that while we are still in the containment phase, we're also looking at the managing stuff now, given the fact that the containment is proving very, very difficult. Royal Easter Show coming up, NRL fixtures starting to come up, AFL 2. What sort of blueprint are we looking at going into the next couple of months as containment slips away?
I think that let's take each day as it comes at the moment. That's the important message. The health authorities are working very hard with all of the other government agencies and our non-government partners to make sure that we keep the community safe, and I'm quite satisfied that those conversations will do everything possible. And I say again, as I've said before, there is no other place on this earth that we would all rather be than during this challenging time. So I'm sure that we will handle those issues as they arise. Thank you.
Can we expect some changes to those big events? I mean, without committing you to a specific plan, I mean, you have to have contingencies already being looked at.
As I said, each of those non-government organisations, sporting events, etc., are talking to the health authorities, and they are giving them the advice that's appropriate for now and for the future. So let's just see how we go.
Premier, can I
ahead of ourselves, okay?
Can I just ask a WestConnex
That was
curveball?
supposed to be the last question.
Premier,
I'll let the health people go then.
Yeah,
Now onto
just
other
one
topics.
quick
Thank
one
you
on
very much.
WestConnex.
Thanks everybody.
Thank you.
Yeah.
Why is the government thinking of selling? Why is the government thinking of selling? Are you short of cash?
Absolutely not. The reason why we're proceeding is because we want to not only maintain our infrastructure delivery, but look at opportunities where we can potentially bring things forward and do things more quickly. And when you have extra money to be able to do that, that's a positive thing. And I'll make this point that New South Wales has been through a horrible couple of months. Things have been very difficult, but the one thing that has sustained us, if you looked at the growth figures from all the states that only came up a couple of days ago, New South Wales in the last quarter grew at 0.5%. Victoria contracted, they were at -0.1. And the reason why New South Wales is staying resilient is because of our public spending and infrastructure. We need to maintain that and where possible accelerate it. And there's no doubt we also need to rebuild those communities. We've already set aside $1 billion to support bushfire impacted communities. So this is about really making the best out of something sitting on the government's balance sheet. Without getting too technical, it's a financial vehicle. It's not going to make one iota difference to our customers, to our citizens, but it will make a huge difference in us being able to deliver our projects sooner than we expected.
Isn't it a broken promise? Isn't it a broken promise? The key question, did you make a promise about no more profit?
Can I be very clear on that? Before the election I was asked, are you going to privatise electricity? I said no. Do you have any plans to privatise water? I said no. But I've also said on numerous occasions, both before and after and during the election time, that we will always look at opportunities that are going to improve the life of our citizens. We will always look at innovative ways to do things. In fact, on a number of occasions we took decisions in the last term of government which were then adopted by Labor states. So we are a state that prides itself on being innovative. We're also a state that prides itself on, where appropriate, we take things to the community, but on other instances where we don't need to take things to the community, we have the Parliament to keep us accountable. Thank you.
Well done.
Thanks everybody.